ECT stands for electroconvulsive therapy, but you may know it as shock therapy. ECT is a biomedical therapy for severely depressed patients in which a brief electric current is sent through the brain of a patient under anesthesia. The people that are most likely helped by this therapy are patients that suffer severe depression. This specific type of therapy is very effective in treatment-resistant patients who do not end up responding well to drug therapy. How it works. ECT uses electrical currents that are sent through the brain of a patient. The patient will be given a drug that prevents injurious seizures. During the procedure, the patient will be put to sleep. They will not feel anything or most likely remember anything. Electrodes will be applied to their scalp and an electrical current will be delivered. This current causes a brief seizure. No one knows for sure how ECT works, but they believe these shock-induced seizures calm neural centers where overactivity produces depression. Now, here are some interesting statistics that pertain to ECT. One, an estimated 100,000 people receive ECT in the U.S. each year. 2, after 3 sessions each week for 2 to 4 weeks, 80% or more improve with no brain damage. 3, about 4 in 10 ECT-treated patients are known to relapse into depression within 6 months. 4, when other medications are not used to treat mental health conditions, the success rate of an ECT treatment may be as high as 90%. And 5, the results show that of the 307 people who were treated with ECT during the 2004-2005 period, 69% were women and 31% were men. The majority of the difference is due to the fact that more women present themselves with depressive disorders. Now it's time to bust some of these myths about ECT. Myth 1. It is only used in mental hospitals. The truth is, treatment can be given at a hospital or psychiatric institution on an outpatient basis for less severe cases. Myth 2. In today's world, it is dangerous. The truth is, in the early days of ECT, they were relatively unsupervised and unregulated. Today, however, the procedure is performed under medical supervision, and patients are given general anesthesia before the treatment and a muscle relaxer to ensure that the seizure is mild. Myth 3. It can chip teeth and break bones. The truth is, because doctors give patients muscle relaxers to prevent them from seizing violently, issues like chipped teeth and fractures have been almost totally eliminated. However, there is a risk for a rise in blood pressure and irregular heartbeat. Now, here are some extra resources that you can share if you or anyone you know would like more information on this topic, specifically regarding ECT.